Who we are is defined by the work we do, the people we care for, and the community we serve. Midstate Health Center meets the healthcare needs of the families who live, work, and visit our rural region in central New Hampshire. We are driven by a single mantra: we do what is right for our patients. Our health center first opened in 1998, filling a void for primary care in our region, and today, over 2 decades later, Midstate continues to provide high-quality healthcare to all who need it, regardless of their ability to pay. With 4 offices in Plymouth and Bristol, New Hampshire, we offer a wide range of services, including primary healthcare, dental, behavioral health, recovery, imaging, laboratory, pharmacy, and support services, serving more than 12,000 patients a year. We treat each and every one of our patients with respect and compassion. We're here to help every step of the way. Midstate is rooted in its rural community, and we are committed to its health and well-being. Surrounded by nature and activity, promoting wellness is a pattern of our lives. This region is where neighbors help neighbors. Grassroots come together to meet the needs of our community. Midstate is a proud part of that community, and we continue to grow with it, helping to build the foundation for healthier lives and helping the next generations thrive. Our goal is sustainability. This means that Midstate can continue to build on our history of providing accessible healthcare services to the people we serve. Because that is what defines us: the people, the place, our community, and our patients. Midstate Health Center, where your care comes together.
Hi, I'm Bob McLeod. I'm the CEO of Midstate Health Center. So Midstate is constantly on the move to improve services, to add services that the community doesn't have right now. And it's often said that the future depends on what we do today. And what we do today is very important. So some of the things we're doing now is we're expanding our imaging services here at Boulder Point, and it's been a real big plus for our physicians and nurse practitioners to be able to send someone to our imaging department and get a diagnosis right away while the patient is still here. We're also very proud of our Feed the Need program, which is one that has served a lot of patients here, and thanks to the generosity of community members, that's become a real success. As you know, we're doing more with the Children's Learning Center. We're expanding it. So why are we doing that? It's not really the core mission of Midstate, but it's an important aspect of community services. So we want young families to stay here. We want young families to move here. It's good for the families, it's good for the economy, it's good for the community. We're also looking to expand our services in the area of physical therapy and occupational therapy. As of January 2022, those services will be part of Midstate, thanks to a transition that we have with Pemmy Baker Home Health. That's going to provide a real service for us. In addition to that, there's more to come with our Plymouth Main Street facility, in which we're going to be opening up outpatient services that can address the needs of all demographics, old and young, and also do it in an accessible and an affordable way. So as we move forward, the community will move forward, and we will continue to provide the services that we think the community needs, and we're always looking for other opportunities to do that. What Midstate wants to do is it wants to be innovative in every possible way it can, and the healthcare landscape and the needs of the population are changing constantly, and we have to change with that. We have to have more immediate access to medical appointments. We have to do more with substance use services. We have to do more with oral health services by expanding it and expanding our reach. To do that, it promotes a healthy community. And can you imagine having a children's learning center where the parents can go to work and be comfortable that their child is being taken care of by quality professional people? That is a big deal for this community, and it should be for other communities around the state. I'm proud to say that we're the first health center in the state of New Hampshire that has decided to expand its learning center. It is becoming a model, and we've been asked to speak to other areas of the state to describe how we've accomplished that and why we accomplished that. We think we have the opportunity to meet all ages and their needs, whether they're the youngsters, whether they're people that are in their early 30s that may have some sports injuries or other things that they need to take care of, or whether they're elderly and they worry about their own health or their partner's health. We're here for them. We're here not only from a medical standpoint, we're here from a counseling and a behavioral health standpoint as well. Every turn of your life, Midstate is here to help you out. Midstate is proud to say that we are an integrated organization, whereas anything we do in one aspect of health also can link to something else. So let me give you an example of that. So if you've gone through substance use services and you've not taken care of your oral health, we connect you with that provider to our oral health provider to take care of your oral health needs. So often we've seen a transformation of people. They address their recovery services and then they take the next step and they get better at their oral health. And everything improves in terms of their outlook on life. Whether it be medical, if you come in here and you have some other issues that you need to work through, our medical providers will touch base with our behavioral health providers and see what we can do to address those concerns. We're integrated. That's what every health system should be. We're proud that we're at the leading edge of that.
My name is Peter Laufenberg. I am the president of Midstate. I joined the board in 2014 and have served as the vice president for a number of years and just recently became the president of the board. One of the great things about the Midstate Board of Directors is that we are all patients here. And so not only are we patient-centered because it's the right thing to do, but we're patient-centered because we're folks that have to get our primary care for Midstate as well. So anything that we do is through a lens of looking at how is it patient-centered, how is it making sure we're serving those who need that service coming in the door, whether it's us as a member of the board or it's someone who just needs primary care for the day. Well, the mission of Midstate is to provide primary health care to anyone who needs it in this region. And so, we work with the CEO and his team to make sure that we're carrying out that mission and obviously looking at the bottom line and the fiduciary responsibility that we have, but also making sure that we're looking forward with new projects and new ideas, right? Because this is an environment, healthcare is an environment that's always changing, so we always have to be ahead of the game. And so we balance that fiduciary responsibility with also making sure that those projects are going to service the community and fulfill our mission statement. At the end of the day, the history of healthcare institutions like this is to provide healthcare to everyone. So that's our bottom line, and that's the goal we try to go for. But we also look for projects that are going to help expand our mission and help the people that we serve. An example of a project that expands on our mission is the Little Antlet Child Care Center that Midstate will be opening later this year that is going to provide care for 60 children in the community. That was an example of both seeing in the pandemic that we needed child care and also just in this community that we needed. Midstate always had a child care center, but here was a great opportunity to add 60 children to a child care center and also build upon our mission of helping those in the community. Child care isn't necessarily primary care, but it is certainly something that adds to the value of this practice, but also helps the community. I have a lot of pride in this organization from when I started, but I think the hallmark of that is we just went through a pandemic, and the thing that I'm most proud is that we never laid anyone off. We encouraged them. We actually gave them a bonus at the end of the pandemic for all the hard work they put into it, because not only were we able to help people, we were able to help those that work for this organization. And to me, that is just a perfect example of what we do day in and day out and how we rise to the occasion even when we're presented with probably one of the foremost healthcare challenges we've had in the last 20 or 30 years. Midstate has a very bright future ahead of it. Both our mission, our strong mission statement, our strong board involvement, our great management team, and the number of different projects that we are working on top of running a top-notch primary care facility, gives me great hope for the future and great things for Midstate down the line. I would like to thank all the staff at Midstate for making it through the pandemic. We would not have been able to run this facility and do the things that we do well without the work that you did through a very trying time, 18 months of the COVID pandemic. And so on behalf of the board, I'd like to thank our staff for the hard work they have put in over that time.
Hi, I'm Dr. David Fagan, Medical Director for Midstate Health Center. This time last year, I was discussing how Midstate was meeting the challenges of the COVID pandemic. And this year, I'm pleased to say we're in an even better position to adapt to the long-term demands of managing COVID while still providing a high level of primary care to the community. We started this year with a visit by Governor Chris Sununu, who was promoting a grant we were awarded to give out groceries to food insecure families who had to be quarantined. We opened newly renovated rooms off a separate entrance where we can safely treat COVID patients without exposing other people. We started drive-up rapid testing so patients could be treated if needed and kids could get safely back to school and parents back to work. We just got rapid COVID PCR machines that give the more accurate PCR results in just 30 minutes. These PCR results are often needed for travel or getting back to work, and until now they were taking 2 to 3 days to get back. In February and March, we held vaccine clinics that protected over 600 of our high-risk patients. It was a really rewarding experience for everyone who helped out. We had volunteers giving shots, directing traffic, and some Midstate staff who brought in baked goods for everyone to share, and some patients even were getting vaccinated and dropped off treats from their cars. We started a vaccine call center to give accurate and up-to-date information to the community. Community members brought us hundreds of colorful masks that we gave out to patients. All this work managing COVID hasn't prevented Midstate from supporting and expanding primary care services. Our newest provider in Bristol is Janelle Guillaud. The clinic's same-day program has new providers, including Juanita Fernandez and Bill Wilcox, who can see people who call for appointments that very day. Our behavioral health team has been especially busy this past year, and we have a new clinical psychologist, Dr. Annie Taylor, added to the team. We also continue to expand specialty services that people can get at Midstate. Dr. David Biss now comes in weekly to provide podiatry care, and Alpine Clinic continues to provide orthopedic care services in Bristol and Plymouth. The Bristol office can also treat more dental patients since we added Dr. Sunny Gadet, as well as a teledentistry program. Midstate's Imaging Center continues to expand with new ultrasonographers to do ultrasound and x-ray, and we now have a new machine that very accurately detects vascular disease of the arteries. We have a new dietitian, Denise Normandine, who's assisting patients with their nutritional needs, especially important with people with diabetes. We're really looking forward to this next year as we continue to build upon our high-quality services. I expect next year I'll be able to look back again and discuss how Midstate continue to meet the challenges of COVID while providing for all of the primary health care needs of our community.
So Midstate's a federally qualified health center, and really what that means is we get some resources from the federal government to help bring a higher level of care to the region, particularly for the most vulnerable in our community. Our true mission is to make sure everyone has access to high-quality primary care regardless of their financial situation. In order to ensure the community has the resources it needs to stay healthy, Midstate actively works to identify current public health challenges our residents in the region are facing, and we try to particularly focus on those who are most vulnerable. Once Midstate identifies a need in the community, we get to work, and we oftentimes leverage community partnerships to make things happen. Midstate's really creative in addressing community need, and it really aligns directly with our mantra, and that's doing what's right for the patient and the community. And we are at our root a community organization, so it's really important to us that we're addressing all the community's needs, and we go above and beyond to make sure that happens. Our Visiting Specialist program is a great example of this grassroots community collaboration in action. Over the past few months, Midstate's patients are experiencing a really hard time getting access to specialists and like podiatry and orthopedic surgeons, particularly during the pandemic. It's been a real challenge. So Midstate got to work, In order to meet these needs, Midstate reached out to its partners in the region, and through some creative collaborations with the teams at places like Littleton Regional Hospital and Concord Podiatry and Pemmy Baker Home Health and Hospice, Midstate's now able to offer a visiting specialist program at its offices in Bristol and Plymouth.
I sort of think of us as like the Pentagon. We're a city within a city. So once you walk through the doors, you don't need to leave. We have interdisciplinary care here, so we do soft or warm handoffs to other clinicians, whether it be a behavioral health clinician or a dietitian that's here, or walk somebody over to radiology. The staff here is like no other I've worked alongside. They treat each patient with compassion and respect. They also treat each other and hold each other to those high standards as staff members and co-workers. And you can feel that when you're here. It certainly was obvious during COVID. They came to work every day. They ran into the fire, not away from the fire. Many other places closed down, didn't see patients. They quickly got up to speed with telehealth and tent visits or sick visits, seeing patients where they felt comfortable. That goes on and on and on, not just with the pandemic. It happens every day as they face new challenges, new software or a new treatment or a new program that we have here. They quickly get up to speed and they do it wonderfully. So this is a very unique place here at Midstate, between the employees, the patients, the relationships that we've created, the trust, and the fact that we can help patients at the end of the day.
I think this childcare situation has changed, and many of the former providers have retired, closed their doors, and so there's a really serious lack of adequate childcare spaces. And then I see young professional parents driving all over Hill and Dale trying to get their children into good childcare centers. So I can see the need directly.
The Children's Learning Center was founded in 2007. It's my impression that the center was essentially created as a benefit for Midstate Health Center employees. During that time, they realized the tremendous need for childcare in our community. And since then, they've opened the doors to the community. And essentially over the years, this need has grown. And so that's where we are today. We want to meet that need of our community.
Well, in my experience of good childcare, there are so many opportunities for children to participate in activities that they literally couldn't do in a home environment. Whether it's art projects, music, physical activity, early skills towards reading and writing and speaking and listening. These are all embedded in a good curriculum, which I anticipate is going to be part of the Little Antlers program, because I know the professionals that are developing it, and they're really tuned into those types of developmental and developmentally appropriate activities.
Our mission is to be able to provide high quality care for the children of our community. Our Learning Center provides an environment for children that allows them to develop individually, intellectually, socially, and emotionally.
The early years of a child's life are really critical for the development of all of their emotional and social and physical health and well-being. So having a center that is staffed by professionals and really offers care from early childhood all the way through preschool, I just see that as really critically important.
At Little Antlers Learning Center, we feel our goal of early education should be to cultivate the inner desire to learn. And through our program, we have adapted to meet the interests of each individual child. We provide these experiences by preparing the environment for success throughout all of our classrooms. Our children are surrounded by developmentally appropriate materials. Little Antlers Learning Center provides an atmosphere for comfort, cooperation, and community. We pride ourselves in the importance of the relationship between home and school. We feel as though with a strong relationship, it truly builds on the curriculum that we develop and making sure that each child's needs are met.
So Little Antlers Learning Center is going to feel like an incredible learning space for these children. It's going to be open, airy, large, clean, very highly efficient. It's going to be welcoming and inviting and fun. It's going to just be a very healthy learning environment for the children. We can accommodate approximately 20 children now at our current space, and this new location will allow for 60 or more children. We have some great ideas, but for right now, it's about getting the classrooms built, getting the building renovated, and getting the children in there.
The workplace needs good, responsible people to work for them, and we can't fill that need. We have more people in the area and less workers in the area. So Little Antlers can help you out with their learning center, their new learning center coming up, to allow your one spouse or the other to bring the children to the learning center for a period of time, which will help both the parents in their lifestyle and give the children a good alternative of not just being in the house all day.
Yeah, so to date we've been applying for grants for many months now, and we have been fortunate enough to receive currently a CDFA block grant for a public facilities grant is what it's called. We've already been awarded that. We've also been awarded CDFA tax credits, of which we have those essentially pre-sold to many of our local banks. We're in the process of applying for an economic development grant at this moment, which we anticipate will also go through. And as far as any shout out, I'd really love to say that without Grafton County serving as our sponsor, Midstate would have not been able to do this. So they have been incredibly supportive of this economic and child care growth for the greater Plymouth area. We also applied for a Northern Border Regional Commission grant and were awarded $350,000 from them, which was outstanding. And then again, as we speak, we are applying for a USDA rural development loan to cover the balance of whatever we do not raise. And then lastly, we just rolled out our capital campaign, which is more of an opportunity for the community to contribute to this effort. And our goal is set for about $500,000 to raise through the community. That will, if we're lucky, knock on wood, we will be able to cover our $3.1 million construction cost. It's interesting when speaking to many of those that we've applied for grants from, they really are excited about this model because, again, childcare is not our primary business, but our board and our leadership recognized this is a critical need in the community. Someone's got to do it. Who is it going to be? And we said, let's dip our toe in the water, and here we are now. We will be serving 51% of low to moderate income families in the community, which has not been part of our previous mission with our child care center. It was really more of a recruitment retention tool for providers. But now that we have the space, we're going to expand that to all families, and it will be affordable and high quality care for everyone. That allows those parents to get back to work or to stay at work and know that their child is safe and comfortable and having a great time. And to assist these families and children to be well positioned for a healthy future, I think is just a nice layer on top of our integrated healthcare approach already.
Quality early childhood programs provide experiences that meet each child's development, their learning, and their health. They engage families and communities in partnerships, and in turn, create lifelong learners and productive members of society. The excitement for myself and for our teachers, we are so looking forward to this project and so looking forward to the opening of this center because we know the need. We know how parents in our community, families, are desperate for high quality childcare. And to be able to provide that for our families is fulfilling.